Welcome back, and we welcome Dr. Kerry Flintoff to the show today. She's an orthodontist working out of Dr. Queen's office downtown on Nicholas Street. It's great to have you here.
Hey, thanks for having me.
Yeah, we haven't had you on the show. It's great to have you. How long have you been practicing in Kamloops?
Just since last summer. I moved from Montreal last summer.
Good. So we're going to get educated a little bit about why it's important for your children to see an orthodontist. I think, Kerry, a lot of people assume that their children don't need to see an orthodontist unless something is actually wrong. Is that the case?
Well, often you don't see things that are wrong. It can be a little more subtle when we're, earlier in development. So usually it's recommended by the age of 7. Both the Canadian and American Association of Orthodontists recommend having your child see an orthodontist by the age of 7. The reason being, not everyone has developing problems, but there can be subtle things that we're trained to notice. Things like functional problems. So kids that have a persistent, maybe a thumb sucking habit. Things that might be a little less recognized by parents is a mouth breathing habit, and that can affect the development of the jaws. We can look at growth discrepancies, so the jaws being either too narrow or too far forward or too far back. We can spot eruption problems, and this is something that's underlying, which can be really hard to see. And even sometimes if the dentist doesn't have a full x-ray of a radiograph of the patient's teeth, it might be missed. We can also look at spacing problems, so kids that might have a lot of crowding developing.
It sounds like a proactive approach to dental care. We have the picture that we're going to bring up. I don't know if you've just spoken to each of these, but let's take a look at it.
Yeah,
Thank
pretty
you very
much.
much.
It's a great kind of summary that parents can take a look at to see look at things that we might be looking for.
Right.
So it's kind of a good overview of the problems we can look at. A lot of times we won't necessarily treat things early on. There are some things, especially functional problems, that are better to treat early on. Other things we might decide to keep an eye on and kind of follow up patients every 6 months to a year. It's partly just so we can know when the best time to intervene is, and also to limit kind of the long-term problems. And the goal is to make the overall treatment a little more efficient, obviously less expensive for the parents. If we can prevent, treatment further on, that's going to be a little bit more difficult to achieve. And to get the patients, a little comfortable in our office. And I love getting to know them and watch them grow up. So.
Is some of this work or going to visit an orthodontist covered by some dental plans? I mean, how does that work? Do people sort of just need to see this as an investment into what could have been a bigger problem?
Yeah, so depending on how your insurance works, some plans will cover orthodontic treatment. And generally, if it's covered, they will cover an earlier treatment as well. Now, coming in for a consultation, we don't charge for that. So we'll take whatever radiographs are necessary and we'll do the follow-up. And only if there is a treatment recommended, then there'll be a fee associated with that. So there's no harm in bringing someone in. It's always good to kind of get an assessment, and then, you can at least know what you're looking at and know if there are any problems in development.
Okay. Do you often find, though, that you end up seeing people after the problem is already established and you would like to see that be corrected a little bit?
Yeah, in some cases. I find overall, the patients we're seeing in the office have been referred by their dentist in a lot of cases, or there's mothers or fathers that are concerned over the appearance of their child's teeth that will bring them in. There are a few cases, I think, of more severe growth discrepancies that hadn't been noticed early on, where if we're treating it later into adulthood, then often it takes a surgery or something a little more complicated to fix.
And it's nice to catch things early.
Definitely.
There's no denying it. That's great. We're out of time already. Thank you for being here today.
Thank you.
Yes, and welcome back to Kamloops.
Thank you.
You're very welcome. This Dr. Flintoff is located in Dr. Queen's office, and that website is also up on the screen. 321 Nicholas Street. If you would like to make an appointment, you can certainly use the phone number on the screen as well. We're back in 2 minutes. Stay with us.